Hi, my name is Virginia Mize. I am a senior student at North Idaho College in the Medical Laboratory Technology program. This is my capstone project, and today we will be discussing testing for thyroid peroxidase antibodies. We will be discussing patient information, tests ordered, type of specimen required, specimen collection, specimen processing, the testing procedure itself for the TPO antibodies, possible sources of error, our patient's test results, diagnosis. Our patient for this particular case study is a 44-year-old female with a prior history of hyperthyroidism. She has a family history of Hashimoto's thyroiditis. She presented to her physician with complaints of heart palpitations, rapid heart rate, fatigue, anxiety, dry itchy skin, hair falling out, trouble concentrating, and mental fog. After a physical examination, her physician decided to order a thyroid stimulating hormone level, free T4, and the thyroid peroxidase antibody study. As mentioned previously, we're discussing the thyroid peroxidase antibody study, and for this particular immunoassay, we need approximately 1 milliliter of serum that has been separated from the patient's whole blood sample. After the patient gets her laboratory orders from her physician, she presents to the laboratory to have her blood drawn. These are the steps that the phlebotomists and lab personnel will take from this point forward. First and foremost, the phlebotomist will verify the patient's identity and the physician's orders to see what tests have been ordered. They will then gather the required tubes and other venipuncture items necessary. They will obtain consent from the patient. They will perform hand hygiene, don their gloves. Then they will tie the tourniquet above the intended venipuncture site and palpate for a suitable vein, preferably the median antecubital vein. After they have found a suitable vein, they will release the tourniquet, cleanse the area with an alcohol wipe, and assemble their venipuncture equipment while they are waiting for the alcohol to dry. After the alcohol has dried, they will retie the tourniquet and safely perform venipuncture following the correct order of draw. For this particular study, we need serum. So they will be collecting the specimen in a serum separator tube, which can be identified by either a gold top or a tiger top. When the tube is about half full, they will release the tourniquet. When the tube is full, they will remove the tube from the hub and withdraw the needle from the patient's arm and apply pressure directly over the venipuncture site with gauze and immediately deploy the safety device on the needle. They will ask the patient to hold the pressure for them. They will invert the tube or tubes gently 8 to 10 times to mix any additives with the specimen. They will label the specimen tubes with the pre-printed patient labels with their phlebotomist's initials and the date and time of draw. They will check to ensure that the bleeding has stopped and cover the venipuncture site with a bandage or a gauze and an elastic wrap. Then they will submit the specimen and the requisition to the lab for further testing. Once the phlebotomist has collected the patient's specimen, the tube will be allowed to clot completely while sitting upright in a test tube rack. After the tube has clotted completely, it will be centrifuged, and then the serum will be aliquoted into a test tube that has been labeled with the patient information. Thyroid peroxidase antibody testing is done via an immunoassay called a sandwich immunoassay. The method that we will be discussing is using the Beckman-Coulter DXI 800 Access TPO antibody assay. This is a fully automated system. The laboratory personnel will place the serum sample on the analyzer, and the analyzer will then take these following steps. The sample is added to a reaction vessel with paramagnetic particles coated with thyroid peroxidase protein. The TPO antibodies in the sample bind to the thyroid peroxidase. After an incubation period in the reaction vessel, the materials bound to the solid phase are held in a magnetic field while unbound materials are washed away. The materials that are bound to the solid phase will be the paramagnetic particles coated with thyroid peroxidase protein and the TPO antibodies that bound to those proteins. Then protein A alkaline phosphate conjugate is added and binds to the TPO antibodies, thus creating the sandwich. You have the thyroid peroxidase protein, the TPO antibodies, and then the protein A alkaline phosphate conjugate. After a second incubation period, again, materials bound to the solid phase are held in a magnetic field, while unbound materials are again washed away. The chemiluminescent substrate Lumifos 530 is added to the vessel, and the light generated by the reaction is measured with a luminometer. The light production is directly proportional to the concentration of TPO antibody in the sample. Here we have an image of the Beckman-Coulter DXI 800. Now we're going to talk about a few of the possible sources of error that would invalidate your results. First is pre-analytical issues. This could include incorrect patient name, incorrect spelling of the patient's name, incorrect birth date, incorrect physician's name. The list just goes on and on. If the sample is hemolyzed, it would have to be rejected and a new sample requested. If the sample is lipemic, some facilities will accept it, some facilities will reject it. Depends on their methodology. Citrated plasma will be rejected. It cannot be used for this particular immunoassay. And if the patient is on biotin, if they take their biotin less than 8 hours prior to the specimen collection, it can falsely elevate or falsely decrease the results. So they will need to take their biotin a minimum of 8 hours prior to specimen collection. Now we're going to look at the patient's test results. The thyroid stimulating hormone level was 0.120 macro international units per milliliter, with the normal being 0.450 to 4.500 micro international units per milliliter. Her free T4 was 1.2 nanograms per deciliter, with normal being 0.8 to 1.6 nanograms per deciliter, and her TPO antibodies were 501 international units per milliliter, with a normal being 0 to 34 international units per milliliter. The patient in our case study was diagnosed with Hashimoto's thyroiditis.